language disorders and hearing impairment in the early years. We are going to start off with the types of language disorders. There are two main types, receptive and expressive language disorder. Receptive language disorder means that children have trouble understanding language. Expressive language disorder means that children have trouble using language. In receptive language disorder, a child may struggle to understand what people say, understand gestures, understand concepts and ideas, understand what he or she reads, learn new words, answer questions, follow directions, and identify objects. In expressive language disorder, a child may struggle to use words correctly, express thoughts and ideas, tell stories, use gestures, ask questions, sing songs or recite poems, and name objects. In the treatment of childhood language disorders, early intervention is key. Targeted intervention areas in the early years include phonology, semantics, morphology and syntax, pragmatics, and literacy. Phonology is the pattern of sounds in a language. Broken down into more detail, phonology in the early years includes word awareness, rhyme awareness, syllable awareness, and onset and rhyme awareness. An activity for syllable awareness is to clap the syllables in a word. An activity for word awareness is to follow along in a book, pointing to each word that is read. An activity for rhyme awareness is to sing nursery rhymes and focus on the rhymes. An activity for onset and rhyme awareness is to build two-syllable words using pictures connected with letter cards. Semantics is the understanding of word meanings and the relationships between words. An activity to learn semantics is to name things, such as naming the color blue and pointing at a blue square, or naming the animal cat and showing a picture of a cat. Morphology and syntax is the focus on the structure of words and sentences, focusing on increasing sentence length and complexity and using varied sentence types. Pragmatics refers to the way that children use language in different social contexts. Using imaginative play experiences can practice newly acquired language skills. Encouraging conversation is a way to build pragmatic skills. Literacy refers to skills in print awareness, letter knowledge, and matching speech to print. An activity to promote literacy skills could be singing the alphabet. Another activity could be a matching game. Two cards are provided with the same letter in uppercase and lowercase for the whole alphabet, and the child is to match the letters together. Ways to help a child with a language disorder include: talk to your child often. This will help your child learn new words. Read to your child every day. Point out words you see. Narrate what your child does in play. Encourage your child to ask you questions. Give your child time to answer questions. Expand upon what your child says. Causes of childhood language disorders include premature birth, family history of language disorders, genetic disorders such as Down syndrome, fetal alcohol spectrum disorders, autism, cerebral palsy, learning disabilities, intellectual disabilities, poor nutrition, hearing loss or impairment. There are two types of hearing disabilities. One type is the complete loss of hearing, which greatly affects speech ability. The other type is hearing impairment, which could mean a child needs hearing aids to help them hear. Hearing loss warning signs include stops early babbling, frequently pulls at his or her ears, does not say a single word by 12 months, does not respond when called, does not understand people unless he or she is facing them, needs things to be repeated, speaks loudly or turns up the volume of the television or radio. Risk factors of hearing loss include frequently gets colds and ear infections, family history of hearing loss, prematurity, low birth weight, or lack of oxygen at birth. There are impacts of unaddressed hearing loss, and these include limitations in communication and speech, adversely affected cognitive function, social isolation, loneliness, and stigma, limitations in access to education and employment. Rehabilitation for hearing disabilities includes training in the use of hearing technologies, example, hearing aids, cochlear implants, and middle ear implants, and speech and language therapy to enhance receptive skills and develop communication and linguistic abilities. More rehabilitation options include training in the use of sign language and other means of sensory substitution, example, speech reading, use of print on palm, Tadoma, signed communication. Also, the provision of hearing assistive technology and services, example, frequency modulation and loop systems, alerting devices, telecommunication devices, and sign language interpretation. Supporting children with hearing disabilities in the classroom looks like facing the child while speaking, speaking slowly, and using facial expressions and gestures. Using a lot of visual supports, examples, videos, pictures, diagrams, and written instructions. Another important way to support children with hearing disabilities in the classroom includes learning sign language to assist speaking or applying to have a sign language interpreter in the classroom at all times. You can even teach sign language to other children in the classroom. The most important part in supporting children with both language disorders and hearing disabilities is working closely with parents and professionals. Professionals include speech and language pathologists, occupational therapists, and rehabilitation specialists.